Good morning. My name is Scott Miller, and I'm here today with Matt Kerr, and we're from Seniority Benefit Group. We appreciate the opportunity to come in and talk to you about what your Medicare options are as we face open enrollment, which begins October 15th and ends on December 7th. So today we're gonna speak about your options, ask each other some questions, some common questions that we receive from beneficiaries, and specifically talk about how the options differ in the marketplace, starting with Medicare Advantage, and many of you have Medicare supplements with prescription drug plans. So we're going to try to compare and contrast those in today's session, and then give you some resources for you to reach out to us directly. We've got a specialized phone number just for Friendship Village residents. So let's get started. Today's agenda, we're first going to start with what many of you might have had as a health plan for the last 10 or 15 years, a traditional Medicare supplement with original Medicare. Then we'll dive into some Medicare Advantage plans and how those look and how those work, and specifically talk about network of doctors and hospitals, one of which you have right here embedded at Friendship Village. We'll talk about the time frames in which you can make changes and review your plan. And last, we're going to share how we interface with our customers at Seniority Benefit Group. A little bit about Seniority Benefit Group. We are actually located a stone's throw from Friendship Village. We can almost see our building from here. We're literally about 1,000 yards down Riverside Drive, just south of the roundabout on 161. So very, very conveniently located. And so if you have questions, and hopefully when this COVID crisis subsides, we might be able to spend some time there or more access here. But we are an entirely focused Medicare agency. We are an independent insurance agency. In other words, we don't work for one insurance company or the other. We really work for the beneficiary, you, help you choose that right plan for your situation. So we are independent, unbiased insurance agency, entirely focused on Medicare. We're headquartered right here in Dublin, Ohio. I'm from Dublin. I've seen Friendship Village grow from one building to this beautiful campus that it is today. And I like you so much, I bought a building right down the street to house our company. We represent over 10,000 seniors, primarily right here in Central Ohio. So we are very familiar with the marketplace, what plans are available to you, and so I think we can be a nice resource for you as you review your plan options. So let's first start with Medicare supplement plans. And many of you may have chosen a plan when you turned 65, and it might have been a Medicare supplement plan. A lot of you have Plan F. Plan F, it was considered the most comprehensive Medicare supplement plan when you purchase it. Unfortunately, for new beneficiaries, Plan F is not available for those folks anymore, but many of you that have it have been grandfathered and will continue to be grandfathered. When you purchase a supplement, you also likely will have to purchase a prescription drug plan outside of that. So your cost structure is you must pay your Part B premiums to the government every month, which likely comes out of your Social Security check. Also then purchase a supplement, Plan F, Plan G, and we'll talk about those in a moment. And then in addition, many of you purchase a Part D prescription drug plan. Your premiums are based on your age, gender, and potentially a smoking or non-smoking status. So what happens is those premiums do go up every year. They're not generally catastrophic increases, but over time, those premiums creep up pretty steady. When you choose a Medicare supplement, there's truly no networks involved. If your doctor or hospital accepts Medicare, then you're able to visit that doctor or hospital. So there's no networks involved with that, with those plans. Traditionally speaking, for a Medicare supplement, you have higher monthly premiums resulting in lower out-of-pocket costs. So we'll compare and contrast that with a Medicare Advantage plan, but that is generally speaking, you're going to be paying a monthly premium plus a drug premium plus your Part B premiums. So the next slide kind of outlines some average costs of what supplement plans are available for. We listed an average cost for an 80-year-old. I realize some of you are younger than that, and some of you may be older than that, but these are averages in the state of Ohio. The average premium for a supplement plan F is $315 a month for an 80-year-old. Is that a male, Matt? Yep. 80-year-old male. So you can see that is an annual spend of about $3,780. Plan G is what we call the heir apparent to Plan F, is a similar plan design, except that you would be responsible for the Part B deductible each and every year. So in other words, the plans are exactly the same, except when you go to a physician under Plan G, the first time of the year you're going to pay that Part B deductible until that Part B deductible is satisfied. Part B deductible is
currently for 2020, that's going to be $198, and that is a calendar year deductible. So once that's been satisfied, you would have no additional out-of-pocket for the remainder of that year.
So very similar to Plan F, but so folks that are turning 65, where you chose maybe Plan F, they're choosing Plan G. Now you can see that the premium difference is pretty significant, about almost a $1,200 difference a year for having that Plan G, and again, you're only responsible for that $198 deductible. So it makes sense financially today for folks to even make a change from Plan F to Plan G. National average for a Part D plan is $396. That can vary widely, but that's the average annual cost. So if you have a Plan F and you have a Part D plan, your average spend on just those two premium items is right around $4,000 for an 80-year-old male. So that kind of gives you an idea of what your spend is. Now, next we're going to talk about Medicare Advantage plans, and I would say that they're the new kid on the block, but really these plans have been around right from the millennial change to 2000. Right around that time period, Medicare Advantage plans became more advantageous to look at. And today, we're seeing a very big trend of people choosing Medicare Advantage plan, and even folks that have original Medicare and a supplement looking at a Medicare Advantage plan. So these plans, and we're going to go into some depth here, replace original Medicare. So in other words, what happens is your A and B gets assigned to an insurance company that you choose, and in return, they deliver the same benefits or better than original Medicare, but just in a different fashion. Plans are sold by private insurance companies, so the usual suspects of insurance companies that you see advertised on TV sometimes will offer both a supplement and an Advantage plan. And by the way, you can't have both.
Right.
People always ask, can we have both of these? And the answer is no. The primary difference is, and I don't want this to be an overriding concern, but you use network doctors and hospitals. And why we're so lucky in our marketplace, and really it's kind of a nationwide trend, is the network of doctors and hospitals that we have here in Central Ohio are very large, very extensive. And Matt, would you say when you're meeting with the beneficiary, how often do you find doctors and hospitals that people want to go to on the networks?
I can't think of a situation where I wasn't able to find at least a couple plans that offered all those providers in the network. It may be a different plan, but they're very widely accepted here in our market.
And what's really unique about being a resident at Friendship Village is you have one of these network doctors right here located in your facility. And from my understanding, it's very convenient, very easy, and it's a Central Ohio primary care doctor, and that service works very seamlessly with the Medicare Advantage plan. So most of these plans, whereas if you have original Medicare and a supplement, you have to go out and purchase a prescription drug plan. With these plans, the prescription drug plan is often built right into the plan. So you're not choosing, you don't have to go out and buy it separately. It's already built in, and the structure of it looks a lot like your current prescription drug plan. Many of these plans include extra benefits like vision reimbursement or dental or hearing aid discounts and services. They include free gym memberships if you're an outside resident of Friendship Village. And here's what's really noteworthy, and people often say it's just too good to be true. There are several plans, and I would say 99% of the plans that we write with Medicare Advantage have a $0 premium. So remember, let's back up a slide and talk about where we're spending almost $4,000 in premium. The Medicare Advantage plans have, generally speaking, in our marketplace, the ones that are being marketed are $0. So you must continue to pay your Part B premiums, but your actual premium outlay is in many cases $0. If you happen to travel, if you're a resident that stays here during the summer months and goes south or west during the winter months, there is what we call it, I call it the Snowbird Provision, where you can, when you join one of these plans, you can access care in, let's say, Naples, Florida, or Arizona or California. So that is often available with these plans. So what we'd like to do is, well, first answer the question, how can a Medicare Advantage plan have a $0 premium? You paid the government, or your spouse paid the government through their work, Medicare Social Security tax throughout your lifetime when you were working, which actually pays for your Part A services. You also continue to pay your Part B services. And you pay that in a monthly form, probably coming out of your Social Security check, is what's happening. And in return, the government uses all those dollars to pay your health insurance company to manage your plan. And what we've got here is we've created, before we go there, I want to share with you the growth of Medicare Advantage. And we're seeing it more and more every day.
Yeah.
And maybe you want to speak to people turning 65. What would you say is Matt, what would you say is the split between people that choose original traditional Medicare versus Medicare Advantage?
I would say over the last couple of years, we've seen a small decline with those choosing original Medicare and a supplement. I'd say it's probably about a 40% to 60% enrollment right now for new turning 65 coming to Medicare.
So 60% of our people turning 65, and I would tell you in certain markets that's even higher because the networks are so strong that are turning to Medicare Advantage. You can see here by this slide, the Medicare Advantage enrollment has grown significantly, and we're almost at 25 million Americans on Medicare Advantage. Ohio is a state that has close to 40% penetration of people choosing a Medicare Advantage plan. Only states that are higher are like Florida, Pennsylvania, our neighbors, and Michigan also has a higher population of Medicare Advantage. But I see in our larger markets like Columbus, Cincinnati, Dayton, Cleveland, you're seeing a really big growth opportunity and people choosing it. And there's a lot of reasons for it, one of which is the simplicity of it. Our next slide speaks to who would be helping you if you wanted to review your coverage, whether you want to review your supplement, your prescription drug plan, or a Medicare Advantage plan. Here are our advisors. Again, we're right down the street. Matt is your primary contact for Friendship Village, and he's readily available to set up a time to discuss this in more length. We are COVID friendly and aware. We're doing
Zoom sessions and phone calls, and so we have ways to make it work for you so that you don't have to come out and over to the office right now, but we can still do a virtual meeting of some type.
Right. And what I think is a bit unique about our company is not only would Matt help you on the front end, you have a support team, again, located right there, that if you have questions along the way, you lose your ID card, your a specialist retires and you need another specialist, or you're traveling out of town, we have a team of people that help you with those types of questions and services. So if Matt is not available, you have a team of folks available to you. Let's talk next about open enrollment dates and deadlines. Many of you that have a prescription drug plan, a supplement, you would have got your annual notice of change about your drug plan only. You won't get an annual notice of change about a supplement. Or those that have Advantage now, you will get a annual notice of change. You should have got that in September. It's a legal looking packet.
Big little packet there.
But it does show you what you had last year and what you're going to have next year, or what you had this year compared to next year. Plan information, we are able to now see what the plans look like for 2021. And we have really good news and a lot of good options for folks for 2021. And that's a good segue. What's really neat about our business now, and I think the insurance companies have recognized it, when many of you may have purchased a plan 10, 15 years ago, there wasn't a lot of choices. Now we have a lot of choices with a lot of bells and whistles, a lot of extra benefits, over-the-counter medications that you can or in supplies that you can get from Advantage plans, some dental coverage which hasn't been historically available. So real open enrollment starts on October 15th. That's when we can actually make a change from one plan to another. And we have invested in a online system, so when we have a discussion with you over the phone, we can easily work the enrollment right over the phone. This ends December 7th, and that's the final day for enrollments for 2021. Those will become effective on January 1st. Like I mentioned, we've invested in a tool and an enrollment system. It's called Shop and Compare, which will allow you to shop and compare your prescription drug plan, your Medicare Advantage plan, and we can do it remotely and virtually. So it is really a state-of-the-art system. Like I mentioned, Matt is the primary contact for Friendship Village, and we have set up this year a direct line, we call it the BAT phone, to Friendship Village, which is 956-3014. It has a distinct ring into our office, and we're able to record statistics and so forth, but it's a direct line that Matt will get back to you, either schedule an appointment or help answer your question. Also, if you're email friendly, we recommend, because it's a very busy time, from October 15th, well, really from now until October or December 7th, we're really, it's very brisk at our office. I recommend that you email Matt, hey, I'd like to review this, and he can get started and get you in the right place. So really important that you can reach out in a couple different ways. Like to thank everyone from Friendship Village for having us in. One thing I want to ask you, Matt, before we depart here is, if you choose a Medicare Advantage plan, do you have any comfort in being able to, if you don't like it, go back to original Medicare and a supplement? Can you explain that?
Yeah, so Medicare does have what we call a 12-month trial period. So for those of you that have always had traditional Medicare and a supplement since you first joined Medicare, you do have an opportunity to try a Medicare Advantage plan like we were talking about today for up to 12 months. If you find that it's not for you, we can go back to traditional Medicare with the supplement and receive guarantee acceptance back into that supplement, so you wouldn't have to go through medical underwriting and answer those medical questions. But that does only last for a 12-month period. So if you were to be on the Advantage plan more than that time period and want to go back, that's when we would have to answer some questions medically. But we found over time, those who try out the Medicare Advantage plan very rarely choose to go back to traditional Medicare with the supplement.
Right. So that's something that you might want to think about taking advantage of, because it truly is a 12-month trial or test drive, if you will, of a Medicare Advantage. And if you're not feeling comfortable about it, you can always revert back to original Medicare supplement and a drug plan. Let's speak a little bit about COPC in the office here. What's really encouraging for us is that this particular office participates in 4 Medicare Advantage plans here locally, and they actually have a special even enhancement to Medicare Advantage called Senior Care Advantage. And the 4 companies that they work with through Senior Care Advantage are Anthem Blue Cross and Blue Shield, Aetna, Medigold, and Humana. So those 4 companies this office participates with. So when we review a Medicare Advantage plan and you are accessing care from downstairs, those would be the ones we would probably start talking with you about. So really great time of year. I think I'm here the first day that visitation is allowed at Friendship Village. So hopefully this pandemic will be something of the past very shortly. But in the meantime, reach out to us, send Matt an email, call our special hotline if you have a question. That's what we're here for. I thank you for your time, and we look forward to meeting you.